Hello, my name is David Trimberger, and this is attempt number 2 at needle cricothyrotomy. So the first thing that I want to do is gather up all my materials, such as a large bore over the needle catheter. Today I'll be using a 14 gauge. I also want to make sure that I have a 10 millimeter syringe, a suction device, capnography, some form of cleaning solution, bulky dressings with tape, and then as well as a BVM and a ET tube adapter. And then for the sake of the skill, it also calls for oxygen tubing as well as a ventilator device. For today's skill, I'm going to be using a BVM. If I were to be using a ventilator device, I would want to allow for 1 second for inhalation, 2 seconds for exhalation, and just continue to monitor my patient as they are on the ventilator for any changes in patient condition. Okay, so moving on from that, after I've gathered up all my materials, I am going to put on proper PPE. I'm going to come over to my patient, lay them supine, and then I'm going to hyperextend their neck. Once I have hyperextended their neck, I am going to ventilate them with BLS measures, just trying to see if there's any way if I can still breathe for them. If I am unable to intubate, then I'm going to consider needle cricothyrotomy. So I'm going to come over and find the cricothyroid membrane. Once I find it, I'm going to take my cleaning solution and I'm going to clean around the thyroid, or the cricothyroid membrane. After I have done that, I'm going to remove my needle, inspect the IV for any burrs or anything. Once I have done that, I'm going to go at a 45-degree angle, and then I'm going to insert my catheter. Once I have done that, I'm going to aspirate the syringe, see if I can get any bubbles, which I did. If I get bubbles, that's another way that I can confirm proper placement. After I've done that, I'm going to advance my catheter, remove my needle, put all of that in the sharps container. Then I'm going to come over and attach my BVM or my ventilator with my ET tube adapter to my needle. And then I will ventilate my patient, continue to ventilate my patient, monitoring for adequate chest rise and fall. I'm also going to do a secondary confirmation by connecting my BVM to capnography. I can also auscultate over both of the lungs and the epigastrium to make sure that I'm getting proper air movement. And so after I've confirmed proper placement, I'm going to come over and stabilize my needle with a bulky dressing. And then after I'll continue to monitor my patient for any changes in patient condition, as well as adequate chest rise and fall. I'm going to be monitoring their SpO2, signs of hypoxia, and capno, and then assess for any change in patient condition while en route to the hospital. Thank you.